CEO of Children's Action Alliance. And we're here today to talk about Medicaid and healthcare. And Medicaid is really an American success story, and particularly an Arizona success story, because we have one of the most well-respected, efficient Medicaid programs in the country. And even though Medicaid is a huge success story, and all of the research tells us that children who are lucky enough to participate in Medicaid are less likely to drop out of school, more likely to graduate, they're healthier, more productive, have higher incomes as adults, and they become healthier adults and have fewer visits to the emergency room. All good things that we look for. Even though it's such a success for children, for parents, for adults, we have elected leaders both here in Arizona and in Washington who are looking to weaken Medicaid and to go backwards. And that's what we're here to talk about today, and talk about why that is the wrong direction for Arizona and for our country. So right now, I'm very happy to introduce Sam Richard, who is Executive Director of the Protecting Arizona's Family Coalition.
Thank you, Anna. And it's Richard, R-I-C-H-A-R-D. And we also sometimes go by our acronym PAFCO. And we are here today with 2 million reasons to stop this madness. Work requirements, lifetime limits, and lockout periods, these aren't serious proposals. These are hollow solutions built for a soundbite, desperate in their search for problems that don't exist. The reality for our 1.9 million neighbors enrolled in Access is this: it works, it's a success. For 35 years, Arizona's Medicaid program has served as a model for states across the nation. Innovation has led to effectiveness and big thinking to breakthroughs in the access to and the delivery of health care. But the changes proposed put at risk the 3 decades of progress that Arizona has made on behalf of its citizens. In his State of the State address just 11 days ago, Governor Ducey doubled down on his commitment to provide opportunity for all. It seems as though legislative leadership might have missed that memo. In fact, the proposed changes are rooted in a naked ideology that has no understanding of the reality that those deep in the experience of poverty face on a daily basis. The legislature shouldn't be in the game of picking winners and losers, yet recklessly tinkering with the machinery of health does just that. PAFCO and the groups represented here today stand firm in our belief that Access is a point of pride for Arizona and its citizens, and that the individuals and families enrolled in Access deserve dignity and real opportunity to thrive. Furthermore, our state healthcare ecosystem is threatened by the current uncertainty in D.C. But we know that Senators Flake and McCain can shift that conversation today by signaling their refusal to support the repeal of the ACA without a replacement in place. Arizonans deserve care, not chaos, and it is incumbent upon Senators Flake and McCain to demonstrate their strength of will and leadership that carried them to Washington in the first place. The 2 million Arizonans enrolled in Access are looking to Senator Flake to find the courage necessary to chart a course away from the empty rhetoric so common inside the Beltway and toward real solutions. Working families are asking Senator McCain to return to his nonconformist roots and buck partisan expectations. No repeal without a replacement, care not KS, and Access is a success. These are the messages we want you to hear. Thank you.
Morning, I am Martha Seaman. I am president of the board of Valley Interfaith Project, and I'm joined by one of my colleagues in this work, Pastor Don Benton of Scottsdale United Methodist Church. Valley Interfaith Project is a broad-based, nonpartisan organization of diverse faith congregations, schools, unions, and nonprofit organizations. And we've been committed to building sustainable social and economic change. For more than 25 years, VIP has been working on issues that promote human development in Arizona. We are deeply concerned about changes to the healthcare system that serve so many Arizona families. First, we urge our congressional leaders, particularly Senators Flake and McCain, to oppose the proposed plan to repeal the Affordable Care Act without any sensible replacement. We believe that putting health insurance coverage for hundreds of thousands of Arizona children and adults at risk will throw our state economy and our healthcare system into chaos. It's just irresponsible. Second, we say to our state legislature that we oppose plans under consideration that would create new barriers for people with low incomes to enroll in healthcare coverage through access. Access means access. Our traditions teach us that we have a responsibility to protect vulnerable children, individuals, and families. We need to be true to those traditions and make our voices heard.
And yes, I am Pastor Don Benton at Scottsdale United Methodist Church. First, I want to address just the Republican response in Washington, soon to be. There's been a movement to repeal the ACA. And like Martha said, it's just irresponsible to get rid of something that is working and functioning without anything in place. It came to mind that it's kind of like complaining about the red lights stopping people, so we should just eliminate lights on the streets. There will be a lot of chaos. But there's also a big fairness issue. And I want to talk about that just real briefly. If they follow through with an elimination bill that President Obama vetoed in January 2016, it would provide large tax cuts to the highest income households. More than half of the benefits flow to those with incomes over $1 million in 2025. At the same time, eliminating the ACA premium tax credits would raise taxes on 7 million low and moderate income families who use those credits to purchase health insurance. I just want to talk real briefly. I am in Scottsdale right now. I am hands-on with a lot of things with the schools, the healthcare, Honor Health, and other groups. And I have many people in our congregation who are very, very wealthy and very, very poor. And all of them agree that there's going to be a big problem if ACA is just eliminated without something in place. And I pray that Senators Jeff Flake and John McCain do the responsible thing by supporting the ACA.
Jamie Willett, who knows firsthand how important Medicaid is for people in Arizona and throughout the country. Jamie?
Thank you for your time today. My name is Jamie Willett, and I'm a full-time graduate student at ASU and study social work. I'm here like many to speak about the Medicaid lifetime limits and work requirements that are currently being proposed. I have immense passion to help underrepresented populations and have worked in a variety of social service settings. In school, I am completing the Policy Administration and Community Practice program, and I intern at Mental Health America of Arizona, where I promote the mental health and well-being for all Arizonans through education, advocacy, and the shaping of public policy. My passion to help others and make positive change on a larger level is what's brought me here today. It is our civic duty to protect health coverage for Arizonans. Many people would be at risk of being suspended from access coverage with the change being proposed, which could lead to bankruptcy and delayed or uncompensated care. These requirements would undermine access to care and may send people backwards in their recovery. These are members of our communities, low-income individuals, and many that struggle with mental illness. Diagnoses like depression, anxiety, post-traumatic stress disorder, bipolar, substance abuse, and many other mental health conditions affect an individual's ability to work and access health insurance. I know this because I've been diagnosed with depression and anxiety. I have struggled and went through a lot that no one except myself will fully understand. If I wasn't given the opportunity to access affordable health care through Access, I don't know where I would be today. I receive a variety of physical and mental health services through Access. For my mental health conditions, I receive counseling services, medications, and group therapy, and have reaped the benefits of such services. This assistance has helped me grow and become stronger so I can continue towards my passion to change policy for the better and help people without a voice. The proposal for Medicaid lifetime limits and work requirements on Access will have a detrimental effect on my well-being as well as many others. Do not put a limit on this care and send me back to where I started. My recovery and progress is counting on it. Thank you.
Thank you, Jamie. So we're here at the Wesley Community and Health Center, and places like this, as well as emergency rooms at hospitals across our state, will be in chaos and will be overwhelmed if our Congress votes to pull the rug out from Arizonans and Americans and take away health care coverage. Once again, hospitals will be bleeding uncompensated care costs, and people will not have access to the care they need. Again, we ask our state leaders and our congressional leaders, don't take us backwards on something that's working. And really, we call on John McCain and Jeff Flake, our U.S. senators, to reject this idea that time limits and bureaucratic hoops and repeal without a replacement would shut people out of the American dream at a time when people across this country are calling for all Americans to be part of the American dream and part of our growing economy. We're all happy to answer any questions if you have any. Yes.
A question, Dana. Governor Ducey has said, Speaker Paul Ryan has said, we don't intend to pull the rug out from underneath anyone, and even if we repeal Obamacare, the basic tenets are going to remain in place until there is a replacement. So does that help ease any of your worries?
It does not. And really, especially for Senators Flake and McCain, who really have stood up to Washington maneuvers and tactics, we say, Americans deserve to see what the replacement plan is. Before you tear down what we have, we deserve to see the replacement. We deserve to see who the winners and losers are. We deserve to see how it will be paid for and how you're going to pay for it in the federal budget. So that does not ease any of our concerns. And nobody has put a full replacement plan on the table at this point. We have a lot of, as you say, sort of promises and rhetoric. But Americans need to see the plan. And we need to know that there is consensus and a majority vote for a replacement plan before they tear down what we have now. Anybody want to add anything?
I think I would only add that both Governor Ducey and Speaker Ryan have been pretty public about their reverence for former President Reagan, and he's famous for saying trust and verify, and I think that's largely the position that we have here, that we see a lot of rhetoric and a lot of words that are promising what's next after the ACA, but we cannot rely on trust alone. We need to verify what that replacement plan is going to be before any repeal moves forward.
Any other questions?
This bill that we're talking about, excuse me, in the state senate, I think it's Bill 1092, putting all these limits on access care. I understand this has to be approved by the Center for Medicare and Medicaid. Are you afraid that with the current administration it is going to be approved?
Yes, so the bill that you referred to was passed, I think, in 2015, and it requires the state to resubmit this, what's called a waiver request every year, to the Centers for Medicare and Medicaid Services. And this request has been rejected by the Obama administration. Certainly the Trump administration will consider it with their own criteria. So we are very concerned that it might be approved, even though it really violates the basic core principles of Medicaid. And really what these proposals do to put time limits on Medicaid, to put work requirements when we know that people having Medicaid coverage allows them to seek employment, allows them to stay working, allows them to be healthy and stable. And we have a lot of research and we have many, many stories like Jamie's to show that Medicaid, with affordable health coverage that it provides, is what helps people stay employed and get employed. So adding new reporting requirements, checking in with the government, and then people at risk of losing their care that allows them to stay healthy and work is really going backwards. It violates all the goals that Medicaid has been moving us toward. So we are very concerned about this waiver being submitted and that it might be approved, or parts of it might.